Hello, my name is Randy Olson with the Professional Facility Management Institute and the Pro-FM Credential Program, and I'd like to warmly welcome you to our live FM town hall today, short and long-term implications of the pandemic on facility management and facility managers. We are honored and blessed to be able to sponsor this event for you today. So we're going to begin the discussion shortly, but I just want to go through a couple things prior to that. So first of all, we're going to record the session, and everybody that's registered will receive a link within 5 days to that recorded session. Second, we budgeted a fair amount of time at the end for questions and answers. As we're going through the discussion today, please put in your questions in the right-hand side of the screen and make sure you're addressing that to all panelists. We've got a great group to talk to you today. Our host is Mike Petrusky. Warmly welcome him. And then three of our Pro-FM Commission members, Stan Mitchell, Stormy Friday, and Kylash Ramesh, will be our panelists today. And the panelists are going to take on a couple of topics here. We're going to talk about the impact of the pandemic on FM jobs, kind of outline and give credit to those unsung FM heroes and all the things they've done. And then look ahead. So how are we going to get to reopen our facilities and get back in the facilities, and then the lasting effect of the pandemic on facility management. So with that, Mike, I am going to turn this to you. And what I'd like each of you to do is just do a brief background of yourselves, and then we'll get into the discussion.
Excellent. Thanks, Randy. Hi, everyone. My name is Mike Petrusky. I am so pleased to be here. I have been a part of the facility management community for over a decade now. Very active in many industry organizations, speaking at many conferences. It's always a pleasure to interact with this community. And certainly in the times in which we are operating, it's something we need to gather together and help each other face the challenges ahead. So it's such a thrill to be asked to participate in this discussion. I do host a podcast. It's called the Workplace Innovator Podcast. It's a weekly show. You can find it on all the different channels where podcasts are available, or just go to workplaceinnovator.com. But the idea there is to have discussions with facility management and corporate real estate leaders from all different backgrounds, different industries, different perspectives, and share the challenges and some of the opportunities that we've had in our industry. And certainly I've had over 100 episodes interviewing many people. In fact, I'm going to introduce two of them right now. It's been a thrill over the years to get to know Stan Mitchell and Stormy Friday. And if you want to get a taste of what the show is about, that may be a good place to start. Back on episode 54 last year, we recorded an episode we kind of, how shall I say, we renamed it afterwards, the Stan and Stormy Show, because it was such a fun conversation. So if you want a little smile and a pick me up during these difficult times, it's a place where the show is very lighthearted and also informative. So with that said, Stan, why don't you introduce yourself and tell everybody who you are and what you do?
Okay, thanks very much, Mike. Good morning, good afternoon, good evening to those of you on the call, wherever you are. My name is Stan Mitchell. As I said, my job is I'm CEO of Key Facilities Management. We are a company based in Scotland. And we have been involved in FM this is actually our 30th year, so I guess we need to get a birthday cake out at some point. As a company, we work almost in every continent in the world, so in terms of the subject matter here, I can bring a reasonably diverse experience about how this virus is impacting us all in FM, and I look forward to doing that when answering the specific questions.
Excellent, excellent. And Stormy, tell us about yourself. You are here in the Mid-Atlantic region, as I am. I'm based in Washington, D.C., but you're out by the Eastern Shore, right?
Absolutely. Yes. Thanks, Mike. I'm Stormy Friday. And the first thing I need to say is thank you to all of you out in the audience who've been on the front line throughout this. Some of you have been in very difficult situations, and you are our heroes. There's no question about it. So you are very special to all of us. I've been around the facility management world for longer than I care to admit. Started out as a practitioner in the Environmental Protection Agency. I was a political appointee in the Reagan administration and was responsible for all of the facilities and real estate around the world. Like Stan, I've had a company, the Friday Group, for now 33 years. We are a boutique firm that specializes in building capacity for facility organizations. So throughout all of this, my interest has kind of been in how organizations, facility organizations, are dealing with this, and then how they're interacting with their customers. I've written a couple of books for facility management, and fortunately, I've been on the Pro FM Commission since its inception, and I've been honored to be the Pro FM Commission Chair for the last couple of years. Thanks for letting me do this today.
Excellent. Thank you, Stormy. And to round out our panel, we wanted to get different perspectives. Another regionally close person, but different generation representing the millennials today. We have Kylash. So Kylash, tell us a little bit about yourself.
Thank you, Mike. And I just want to give a thanks to Pro FM and Workplace Innovator Podcast for putting this event together. I couldn't be happy to be here. And thanks for everyone in the audience for joining us today. So my name is Kylash Ramesh. Like Mike said, although I am losing my hair, I am part of the millennial generation. So I'm located in Washington, D.C., and I work at the National Institutes of Health, NIH's headquarters in Bethesda, Maryland. At NIH, I'm part of the operations and maintenance division for facility management within the Office of Research Facilities. So we are supporting the great scientists and doctors at NIH and all of their lab and healthcare space. Historically, I've had to sometimes explain a little bit about what NIH does, and I think now with the way the media and with the pandemic, I think you all know what NIH does. So the most simple way I could put it is Dr. Fauci's labs are at NIH, and we make sure that Dr. Fauci's labs are taken care of, along with the rest of the great NIH doctors and scientists. But I am very excited to share that perspective with everyone today. Thanks.
Thank you, Kylash. It's great to meet you, and we haven't met before now, but I just know based on what you've said already that it's going to be something, relationship that I can look forward to sharing with you in the future. And as we go through this, what will be a long journey together, has been already some interesting times. So I appreciate your perspective, and I look forward to your insight. So everyone, let's get right into it. We want to make this an interactive conversation. I see some questions already coming in. There is a Q&A box in the Zoom platform you are familiar with probably at this point, if you are like me and most of us working from home and dealing with technology tools and Zoom. But I want to start with some prepared questions we have for the panel and start to just frame where we are today, because I host a weekly conversation, a live stream every Wednesday at noon Eastern time. And I talk to my podcast community, my network, and we have seen this incredible, just what seems like years worth of change in the last several weeks. You know, we started 4 or 5 weeks ago doing these weekly shows, and every week the tone and the topics have shifted almost unbelievably. So in the beginning, there was a discussion about the virus had spread, the pandemic began over in Asia and Europe, and then it began coming to the US. So we've had just discussions about, you know, what work from home strategies might look like and some of those practical tips of getting our facilities prepared and our people prepared to make that shift. And then with the mandatory closures, we'll just fast forward through, we immediately started seeing the impact on human health and well-being and the anxiety that was happening as we all realized we're in an unprecedented time and a very unique crisis situation. And then in just this past week, the shift again has gone to what will the new normal be, and how can we as FM professionals and leaders prepare our workplaces, our physical spaces for this new post-pandemic world, whenever that comes, without committing to timelines. It's something we have to be responsible for. So with that as the broad kind of stroke, let's start with where we've been in a very brief way. Stan, you saw it first. You have a lot of clients in Asia Pacific regions and as well as Europe. So just tell us just what you've seen over the last couple of months.
I'll talk more about the regions because in our experience with having people worldwide, the reaction has been very, very different. Obviously, the countries around China were the first to react. And interestingly enough, today they're maybe not the most severe countries at all. It tends to be the mature markets where they are engaging with countries like China, which are emerging very fast, as we all know, in terms of industry and commerce. But a lot of countries have had minimal impact around this, whereas other countries such as the North America, Europe, have been affected very badly. If you take a look at the world map of the virus and its impact, you can see that Africa's hardly been touched. So I think the division on the impact of this tends to have been mature markets and emerging markets is where the divide appears to have come. And then if you look at what we as facilities managers do, there's kind of two comments I would make. For those of us that follow things like the ISO standards that challenge us in our daily activities and how we manage our facilities, to some degree we've been prepared because there's a great focus on risk management. And pandemics such as this are not new. They come along fairly regularly. And also I would mention Pro FM in that context, because if you look at the Pro FM curriculum, the risk management is one of the main highlights about what we should be doing and educating our people in terms of preparedness. So my comment would be some people have been very prepared. Within my own company, whilst there have been surprises, for us it's been relatively smooth. And for other clients that we've engaged with and other communities, they've been caught short in a big way. So it does re-emphasize the need for us to share our knowledge, our experience, and remember we can all learn and we can all improve in what we do and how we do it.
Excellent. Excellent. That's a great summary. And what's happening there has certainly happened here and is beginning. So I look forward to your insight about the reopening of the workplace and some of those markets where they have begun to reopen the economy and how they've handled that. Let's take a moment to share some praise for the FM community, because we have an audience here of many FM practitioners and they're out there on the front lines in many ways. In fact, Kylash, in your workplace, you've already mentioned that you are managing the facilities for some of the public health leaders who are making the decisions at the highest level. Do you have a story you could share just to kind of praise those unsung heroes in the FM community?
Yeah, absolutely. And I think I would like to break it down kind of into what may be seen versus what may be unseen. Some of the common seen things that would be easy to think about are restructuring some of our housekeeping and custodial services to go towards some of the higher traffic or higher critical spaces, disinfecting facilities that have had COVID patients in them, things like putting up signages and plexiglass and those types of things. Those are some of the more common basic things we think about. What's interesting that may not always get out into the general media is we hear about ventilators all the time and the lack of ventilators and that this is a critical medical piece of equipment that's needed. Something that I think gets sometimes overlooked is the fact that facility utility systems and building systems are needed to feed into these ventilators, and it's imperative that the facility managers are turning these spaces into negative pressure isolation rooms and so on are involved in doing so much work in the background that unfortunately may not be able to get seen, but I'm very glad that this type of town hall is able to shed some light on some of those types of things we've been doing.
And we will share more about that. Stormy, I'm sure you have some stories from your client base and the people you know through the years that are, as in the DC area especially, there are many facilities that are still operating, maybe at a limited capacity, not as many of the workforces in the facility at this time, but those folks are still out on the front lines maintaining and responding when there's a reported case of COVID-19. Do you have a story you can share?
Absolutely. I think, again, similar to what Kylash said, that there are many unsung heroes behind the scenes that we don't necessarily read about on the front pages of the paper. And one story that comes to mind is about facility folks who are working in transit bus barns, for example, and the work that they've done to make those buses clean for people as individuals continue to ride public transit. And so some of them have worked long hours and have worked way over their shift time to make sure that those buses and other transit facilities are acceptable. We also hear, and often we don't hear, the kinds of things that we should about organizations like the Army Corps of Engineers that I think have done yeoman's work in terms of developing and preparing, I think, 13 or 16 hospitals across the country. So there are facility folks who, as Kylash said, and as Stan have said, I think we've run the gambit of emotions from originally disbelief to panic, and now coming out of it as to how are we best prepared to meet the challenges of the future.
Absolutely. And I think that's what we want to spend the bulk of our time talking about today. In fact, I'm going to jump right to question 3 because the Q&A box in the chat room is exploding. I thank you all for your participation today and your interest level in this topic. And I think that's where we are right now. I think we have got to begin planning to look ahead to this partial reopening and eventual reopening of our economy and then our facilities. And in many cases, depending on your industry, you may already be there and maybe farther along than others. So share your insight in the Q&A and the chat box as you deem fit. But Stan, let me go back to you and talk about, things reopening. It's happening in Asia. It's happening in some of the original cities where the virus hit. And I know that from my conversations with folks in our industry, it's the top concern right now. And we're going to talk about it all. We're going to talk about the protocols that need to be put into place, some practical advice. We're not going to say we have all the answers here, folks, but we have an incredible panel of experienced professionals who can speak to these questions you have and help you prepare. And then we'll continue the conversation offline after this hour together. So Stan, first thoughts about what FMs can do now to ensure a smooth transition.
Yeah, I mean, I feel that this is our big opportunity. Yeah, there are a lot of people who are managing, as has been said, our healthcare facilities, our care homes, etc., and our public transport systems, etc. And they are doing a fantastic job on our behalf. But I think the big opportunity for FM is coming, where we start to see light at the end of the tunnel and start to look to remobilize the majority of the facilities. And I think that's when our peers, our demand organizations that we all work for and support will be looking for our professionalism. We'll be looking for our preparedness, because if any of us are out there without things to do, this is a great opportunity for the planning and preparing for what I believe should always be a 4-phase strategy of remobilizing any facility. And the first phase in that is about a real audit. It's not about the deep clean. I think that's in phase 2, but it's about the facility audit and risk assessment of the implications, because remember, a pandemic such as this is not a one-off event. Everybody's predicting there will be a second wave of it. And by that time, we may well have started to re-enter facilities that we manage and look after. So a facilities audit to look at all the implications of how we use our facilities and how we can try and prepare and protect the people that come into those facilities from that second wave and ending up back where we started. So for me, that audit, that plan is what FM is all about. It's about being prepared. It's about being proactive. And that is our big opportunity to shine within the organizations that we serve, I believe.
Excellent. And Stormy, as we start talking about specific protocols, what are you hearing? What are you telling your clients when it comes to some of the practical implications of reopening facilities that have been closed for weeks and maybe months by the time some in certain regions get back to work? And let's just talk about the physical space at first, and then we're going to get into this emotional concern and the need to help the people adjust, because I think we're all in a similar boat as we've been awakened to the seriousness of this virus. And as Stan alluded to, it's going to be with us for a long time, maybe a second wave of cases. But as we gradually reopen and then we have decisions to make, what employees come back, who doesn't, and then helping to address the individual needs for people depending on the part of the world you're in, the part of this country you're in, and then the type of work people are doing. So that's a lot to throw at you, Stormy, but it's all part of this planning that has to take place. What are your thoughts?
I couldn't agree with you more. And I think the first step we have to take is to stop calling it the new normal. It's not the new normal. This is the new frontier. And it's an entirely new landscape. There's nothing going to be normal about it. And so what we plan for in the future is what we are going to be seeing, I think, that we have to deal with. And so as Stan indicated, we have to become indispensable, and we will be. And I think in addition to the risk assessment and the planning, we need to be doing posturing. We need to be preparing options for our senior executives. You talked about space, for example. We don't know what space is going to be required. If we have rolling startups of businesses across the country, we may need to be prepared as facility folks to have people housed temporarily in different geographic locations if they're a clean site. And so from a space standpoint, we need to be ready to make recommendations to those senior executives about how that would take place. And so the physical space is going to be something that's going to be a moving target all of the time, I suspect, as the opening of the country occurs and as we roll out where it's going to be safe to be able to work. From a manufacturing standpoint, small businesses are the ones that are going to be hurt the most because they can't ramp up until their employees can get back into their facilities. And so I think the space issue is going to be huge for us, but we need to be indispensable.
And we'll talk more about that for sure. There's a lot of questions coming in about practical application of space and how maybe we can use technology and automation to be prepared for the new frontier, as you call it. It is a paradigm shift, I read just the other day. This is not a new normal or even getting back to normal, as you said. It's something that's significant for this and all generations to come. So Kylash, what's the insight you can share from NIH now and the facilities in which you're operating and your team is operating? What's it look like right now? We've had questions in here, some practical things we've heard on the news about shortage of PPE and some of those challenges. Is that happening in your world, and are facilities professionals being given the supplies they need? I know there's a lot of shortages early on about disinfecting, materials, obviously for the consumer. There was a big run on so many things around cleaning products, and germaphobes like me couldn't get their hands on a bottle of Purell unless they're willing to spend $500. So Kylash, what does it look like for you in your particular facility, and is that something that you're managing well?
Yeah, absolutely. I think this all gets back to something Stan brought up earlier, which is if you had prepared for these types of events in the past and had gotten your risk management planning and assessment down, then you would be more prepared, maybe not fully prepared for this type of event. And having said that, we had these types of things in place. So from what I understand, we have been able to supply our facility staff with whatever level of protection they need to perform the new types of tasks we're asking them to do. I do want to bring up some of the human sides of this topic and question, in the sense that I think the two biggest things we as FMs can do during this time is communicate, which is something we should always be doing, but in addition to that is really staying flexible. So as Stan mentioned, and Stormy, with the fact that this is an ever-changing thing, and the demand organizations that we work for are figuring it out just as we're figuring it out. So no one has this thing figured out, and we may get some type of guidance from our demand organizations that may change the next week. And it's important for us as FMs to stay flexible and to expect those types of changes to be happening even faster than they have in the past, because we are really figuring this out on a day-by-day basis.
Absolutely. And Stan, I'm going to come back to you now. Let's stay on this topic of the reopening and some of the protocols that need to be in place. I know you, I know Stormy, I know many in our industry are data-driven people. We like to see information to make intelligent decisions. And in many cases, that just is not available yet. I did a survey on my live stream yesterday asking, two questions. When will your organization begin reopening their facilities? Will that be next month, May, June, July, or later? Or there was a fourth option. We just don't know. There's not enough information. And then I asked the question of when will you personally be ready to go back? And as far as a comfort level, that emotional, that psychological safety element of this, and the data is just not there. It was a 50-50 split. Some were willing to offer, maybe it'll be May, maybe it'll be June, maybe it'll be July. But many just said, almost half of my audience said, I don't know, it's just too soon. So what do you need to see, Stan, and what have you seen in Europe and Asia that indicates that, yes, it's time to set a date in reopening beyond the government giving us permission to do so?
That's not a simple question to answer. And let me give you a real example. We have a facility in the Far East that is operating, and it needs to keep operating. It's in the food industry. And that facility is about to shut down because we can't get the service providers to give us the service because the government is telling them they've got to stay at home. So for something as simple as scaffolding, can't get it. And it's preventing that building maintaining its systems to make sure that they're delivering the right working environment. So it's the infrastructure that's needed for a lot of these buildings in order to get back up to speed. And that's not what governments at the moment are typically seeing as essential services. So there's an indirect part of FM that can absolutely impact our ability to remobilize.
Wow, that's kind of frightening. We may be talking too soon about this re-entry if we can't even get the materials and the suppliers to be there for us. Stormy, have you any practical advice to FMs on the webinar today as they prepare as best they can? What can they be doing in practical steps to line up those relationships? We've had a lot of questions in here regarding contracts and any suggestions around how to manage vendor contracts and prepare. I know that in some of my other conversations, I've heard that for example, some of the cleaning suppliers are booking way out in advance. They're taking contracts now for that eventual return, the reopening of the office, and that eventual new protocol for enhanced disinfecting and enhanced response when someone does come positive with a case of COVID-19. Thoughts on just practical advice for what we can do now?
Well, and I think we said this earlier, both Stan and Kylash said it, that it's not too soon to start communicating with these folks. While facility managers are wondering whether they should be communicating with their internal customers, their tenants and their employees, they also need to be talking to their suppliers and their vendors and looking for how are we going to be working together and how can we make sure that we have what we need from you when in fact we are going to be able to reopen. I think about, folks that work in the hospital environment, the healthcare environment, for example, who have to adhere to strict JCAHO standards, the Joint Commission on Accreditation. They have always had kind of a higher level of what they would purport to be, cleanliness and standards because of the accreditation. And so I think a lot of facility folks who are on the other side of the coin may start looking to how can we replicate some of that. In order to do that, you have to make sure you have a very strong relationship with your providers and your vendors. And, Stan has evidence of how hard it is sometimes to make that happen. So I don't think it's too soon to start putting those plans in place and building back those relationships to find out how you're all going to work together.
Yeah, good points. And Kylash, do you have, because you are active, and what percentage of your workforce is in the facilities today, and what are you doing to prepare for the eventual gradual and total return, if there is going to be a total return at some point? And do you have any framework you're using now that you could share with the audience as far as how you advise your leadership and what you are advising the employees? Again, and let's get real practical here. Are your FM team members wearing PPE and are they interacting with the healthcare community, or is it a separate situation? And what can you generally advise to the broader audience here today?
That's a great question. And I think Stormy brought up a great point about JACO. In a quick summary, I would say that it's all dependent on what our FMs are working with, right? So the ones in the hospital are going to be wearing a higher level of PPE. That's normally going to be, that guidance is going to come from the doctors and the scientists themselves. We have plenty of other buildings on the NIH campus that also still need to be maintained depending on the amount of occupants that are in there. Some of the changes we've made on our staff that is in the field working on the equipment itself is we have changed their shift schedules so that there's a little bit more triage, and so that we're not putting ourselves in a position where if we only have, a few folks that are really, really technically savvy with a certain building system, we want to make sure that we're not losing all three of those staff members at the same time to the virus. So making sure you have that good coverage across your organization. Something I really think is important that Stormy and Stan have brought up multiple times is getting your foot in the door and a seat at the table when the discussions at the leadership level of the demand organization are going on. So they may have some ideas like, one example I've thought of that came up for us was, people might want to prop doors open now. Right, that might be thought of as a good idea to limit the spread of the virus. So, hey, let's make sure that we just prop doors open, and that way we won't have people spreading the germs on the door handles. Now, there could be an unintended consequence here if an FM doesn't get their input into this decision, because those doors may be fire doors, right? And now we may be causing a fire or life safety or egress issue that actually may be going against our authority having jurisdiction. Same type of thing with Joint Commission or any type of regulatory body. There's this now very intricate balance of how do we keep doing what regulatory agencies have asked us to do this whole time, but now we are somewhat increasing the risk of the disease being and virus being transferred. And I would encourage everyone to try to work with their regulators, whether it's the Joint Commission, your authority having jurisdiction, whoever that regulatory compliance body is. Try to work with them and see if they can, change some of the ways that you're doing things so that the overall risk is managed better. Because I'm a firm believer that the regulatory bodies that are looking at this situation don't want to put FMs in a position where they now have to choose between meeting accreditation and stopping the spread of the virus. We should be able to work in this in a more collaborative way to ensure we're limiting the risk of both sides.
Great points and great advice, because it's going to be a constant balancing act, the risk and the practical application. And there's so many elements I could go with that question, but I want to go back to Stan, because someone in the chat reminded me to remind you, Stan, that you mentioned there are 4 phases to getting back, and we only got the first one about audits and risk assessments. So what comes next?
Okay, I mean, when I talk about audit, most of us are focused on the cleanliness, the cleaning side of that needs to happen. But when you start to sit and think about it, it goes well beyond that. We need to think about our building systems that for those facilities that are locked down right now. So you have air conditioning equipment, ventilation equipment, that's sitting potentially static, that's allowing bacteria to breed. You have filtration systems that probably are going to need a very good change before you want to let anybody into the building. You have water systems for showers, example, that will need completely flushed through to avoid Legionella risks, etc., etc. That to me is all about the audit. It's about identifying what we need to do before we let anybody back into a building. The second phase for me is then go and do something about all of that. Kylash is just talking about doors. Today you can get foot handles to put on doors, so people don't need to use door handles. There are simple things like that that we can do that will both try and avoid a problem, but also demonstrate who we are and why we're there. We can look after these people. We can get the business and the organization mobilized as quickly as possible, but in a safe and proactive manner. For me then, phase 3 is when we start the remobilization, and we start it with caution because that second wave might come. It's not a hard change. It's got to be a soft re-entry into the building. Some people I've seen are commenting upon, do we still maintain social distancing, etc. And I think the smart thing to do is, yes, to some degree we do. And the phase 4 for me is when we finally get back to the new normal, whatever that may be, and we don't really know what that's going to be. Because I think this experience for all of us today is changing what FM's all about in the buildings and the facilities that we are there and responsible for.
Wow, so much to think about, and we can't get into all the details of all of you just said there, Stan, but I'm sure Randy's preparing some links and some information from the Pro FM community to offer up to the audience at the end of this webinar to continue the conversation, and resources that are available to help them answer the questions that you just brought up, Stan, because so many great ones there. And Stormy, that is a great segue back into this conversation around some of the practical implications for space and other protocols that we need to put into place. We had some questions come in even before the webinar because the conversation's out there, right? Are we going to be having our temperature taken before we walk back into a facility? Will we have physical distancing rules? Will we have to redesign space to allow for that extra distance between occupants? Or will we have to do other things to make our employees feel comfortable being back in that environment? And I'm sure you've seen some of the videos, some of the articles that are being discussed. What do you envision it looking like? And have you seen anything that maybe we can again share with the audience at the end of the webinar that's really kind of seeing what this new frontier might look like for all of us?
I haven't seen anything that would be our operating guide for the future, again, because I think we've all said that in some ways every day is a new challenge and we're trying to figure out what the answer is as we encounter it. But I think to the point of as part of what this whole risk is, initially, we need to be doing our posturing. What if, and how do we react? What if everybody coming into a building has to have their temperature taken before they can come through the door? What if we're going to do immunization testing as soon as people come to their workstations? What if we have to have a rolling, back to work activity? And what if, in fact, we decide that we aren't going to need bricks and mortar the way we used to? What if we determine that we're going to use technology to a much greater extent than we already have? I think the facilities organization, the facilities folks are going to have to work closely with two organizations that we work with, but even more closely, and that is the whole IT world in our corporate environment and the health and safety people. In the old days, they all used to be part of facilities. They aren't as much anymore, but I think that relationship is going to be stronger as we figure out what the roadmap is going to be in both of those areas for coming back to work.
Absolutely. And Kylash, I want you to kind of extend on this discussion about some of the practical changes that we may have to implement if they're not already being implemented. Certainly flexibility, giving employees the option to come in or not. If they have the ability to work from home, maybe that'll be more the standard. Have you changed and have you collaborated with, because Stormy brings it up, this great idea, we've always been pushing collaboration across disciplines, whether it's working with our HR community, the IT community for some of the technology tools that will assist in these solutions, as well as security and some of the areas that we need to kind of be all working together and being on the same page to create this safe environment for people to re-enter the workplace. Do you have thoughts on how you're doing now and what's changed, what the future may look like as far as some of those factors go?
Yes, absolutely. I think this just speaks volumes to the reason why FMs of today's age, and especially the new age, really need a multidisciplinary approach, both at the individual skill set level and across the team. So I think that's where Pro FM's done a really good job at recognizing, acknowledging, and then putting a framework behind that. And that's, at least from my experience, where I've found some some advantages or gaps that I've been able to fill in terms of seeing how, whether it's facility information systems, right? Things like integrated workplace management or enterprise asset management systems, in addition to the industrial control systems, right? So using occupancy and automation to both deliver a improved employee experience, but then also we can use that underlying data to make the right decisions about who really needs to be in the office, how far away should these people be sitting, how much extra money is it going to cost us to now have this change of environment? Are we going to have to buy higher cube heights? There's a lot of decisions that have to be made, and you can imagine that if you had a good underlying technology infrastructure with good data sets, standards, business rules, things like that, some of this data gathering that everyone now needs to go through is going to be easier for some organizations rather than others.
Excellent points all around. It's really what we've been dealing with for years in the FM community. It's just this crisis has poured an accelerant on a lot of those needs to make decisions and so forth. And there are a lot of questions that are coming in that are specific to some of the things we've just mentioned. So before we get to those, I want to just kind of let you all comment on this question 4, and then we're going to open it up to the Q&A. And I've tried to weave in a lot of the Q&A already as I've been asking these questions of our panel. But let's start with you, Stan. What do you see as the short and long-term impacts of this crisis, this COVID-19 situation on the facility management profession and our community overall?
I'll unusually be very brief, Mike. Short term, I think for those of us that were at least semi-prepared, it should be a reasonably painless transition to where we are today. Long term, I think this is a great opportunity for us to prove our professionalism and strategic value to the demand organizations that we serve.
Excellent. Stormy?
I would echo what Stan has said, and also I think short term we need to focus on looking at probably those emergency and contingency plans that have been collecting dust on our shelves and see how they need to be updated, because it's not over yet and there will be more of this to come. So I think that's important. And then long term, we need to be looking at where our skills gaps going to be as we get to this new frontier and this new landscape. Are we going to be needing to add new skills? Are we going to be upgrading the skills that we have? And now if people are going to retire at an even faster rate, where are we going to have holes and gaps? So I think we need to be looking at that. And then how do we add value to the business bottom line as the economy tries to jumpstart itself again?
Good point. Kylash, your thoughts on this? You're in it for the long run, I assume, in the FM profession, and you've got a long career ahead of you, I hope. We need bright and shining talent like yourself to lead our industry. So what are your thoughts on this question?
Absolutely. So I think in the short term, the way I view it, obviously by industry and region is going to be a little bit different, but I think overall in the short term, everyone is going to experience a little bit of a delay in this strategic advancement in some areas of their organization, right? So now this new task and new project and whole thing that we now have to tackle with what most likely is the same amount of level of resources we had before the pandemic started. So it's likely that some of these strategic initiatives, in one hand, like contingency planning that Stormy brought up, those might get even promoted and developed faster, but there may be some strategic initiatives that might have to be placed on the back burner while we figure this out. In the long term, I will say that I do think this is going to play a role with 2 other market trends, specifically e-commerce, and then automation, IoT, AI, and machine learning. I think this is going to fit kind of right in with those and somewhat propel those even more. So for those of us that are facility managers in the retail industry, you may have already seen your footprint decrease over the past 5 to 10 years with the advancement of e-commerce. And we all know in the facility management world that with the increase of technology, especially industrial control systems and sensor technology, that there's a lot of tasks that we used to have to do with people that now could potentially get automated. Having said all that, it's as much as I'm a big proponent and believer in technology, it's very hard for me to think of the industry without a facility manager as a person in a building running the building, I've seen too many of the technology systems that have been promised to work perfectly without any human involvement that eventually needs a human to come in and fix it and actually run the building like it always was run in the past. And until somebody shows me that that can be done repeatably, I'm going to imagine that facility managers are going to be needed as long as I'm in the industry. At least I hope.
I agree with you. The emotional intelligence of human beings is hard to replace with an artificial brain. So great comments to you all. And now let's get into the final 15 minutes where it's a live Q&A with our audience. We already have a lot of questions that have come in. And Randy, if you could be reading these as I'm reading them, I have the first few lined up, but as they get deeper and deeper, if you could highlight the ones that I miss here, if they're pertinent, if we haven't addressed them in some way already, that'll be very helpful. But here, the very first question that came in at the beginning of the webinar, I think is a good one to kind of transition from the long-term implications around the facility management profession. It's due to this pandemic situation, what is your recommendation to prepare and create knowledge in our FM team and at the same time complete day-to-day activities? So this thought of continuing to upskill, to adapt, to innovate, to be evolving, that's something FMs have had to do for a long time, right, Stan? So with this pandemic situation, has your thoughts about that, have your thoughts about that changed at all? And what do you recommend?
No, I'll tell you what has changed. It hasn't changed fundamentally for us. We do try to invest in our people and the knowledge that nobody in FM's got all the answers to anything. So we can all learn from each other, and we can all learn in terms of education programs. We as a company have just launched Pro FM Mind the Gap for Teams. This is a new initiative by Pro FM where you can reach out across your team, whether that's geographical spread or just in one building or organization, and get a profile of the competencies as a team. And we're just in the middle of doing that, waiting on the results of that coming back, and taking the opportunity of this pause for some of our people to reach out and embrace them with the professional education and training, and get them to think about the positive, the future, as opposed to thinking and dwelling too much on the current situation. I think that's the one thing we can do for our own people, is get them looking forward. We will come out of this. It will be a different place. So let's be as prepared as we can as individuals for when that day comes.
Great advice. That's a challenge that we all face. I certainly know I do. Is I want the information and I want to be in control, but it just doesn't allow that. This situation will not allow us to know the future, but we have to keep that positive mindset, the optimism, take this time to invest in ourselves. The Pro FM credential, I'm sure Randy will share more information at the end of the webinar about that, is a way to do that, as well as many other resources throughout our community. It's a great community to be a part of. So lean on each other, folks. Don't allow this isolation, this period of isolation to go by without, reaching out not just for your own well-being and mental health, but to take advantage of this opportunity to prepare yourself for what may come. Another question here is around that long-term implications around workspaces and the environment, the setup. I know, Stormy, you've been a consultant, a strategist when it comes to working with organizations to make the most of different strategic approaches to workplace and to facilities. And have you thought through what some of the changes, we have this big work from home experiment going on. I know that there are surveys being done to try to understand productivity and how people are doing while they're working from home. But I really want to focus on that long-term implication for the built environment. Do you have thoughts?
I do, and I probably would hearken to the lessons that have been learned. And I think maybe it was Kylash who mentioned it. In the multi-site environment, used to kind of be called the retail environment, but now is the multi-site environment, particularly in the medically related field, where several years ago, this whole concept of like doc in the box began to spring up, where we had all of the health clinics come about. And most of us throughout this effort have seen our doctors go to telemedicine. rather than going into a doctor's office. And so I think we need to look at alternative ways to work. While it may not work for every environment, it might not work in manufacturing, but it certainly could work in professional service environments where we don't always have to have a cadre of people physically in a location to serve our client base. And so once the parent organizations figure out, and we can help them, how in fact they're going to be serving their customer base, I think the role of facilities will then be to determine how our facilities can support that, whether it's teleworking, whether it's hoteling, if we go back to some of that, whether it's more offices, that all has to be tied to how are we going to be delivering the services that the parent organization is in business to deliver.
We execute the plan. We bring our knowledge and experience and then execute and give people that safe, comfortable environment in which to be their best selves. And I think that's going to still be the case going forward. Kylash, do you have maybe a thought on this question? Because we did talk about some of the protocols that may come into place. And I'm wondering if, someone's asking here about temperature checks for employees and what happens if someone does have a high temperature. And then what do you do when it comes to keeping the information private? There's privacy issues and there's all kinds of elements around that. I know there's technology tools that are being discussed, collaborations between Google and Apple to have this kind of tracking. I think testing, what are they saying? Testing, tracking, and then mitigation depending on the situation. And then who makes this decision? Is it the employer or is it the building operator? And I think many in our audience might be in lease spaces, and there's a concern there because, again, that lack of control. If you've got a building, a property manager having one idea about protocols and then you as a tenant having others, how do we navigate all that in just 2 minutes, right?
Absolutely. I think we are fortunate just being a large federal organization and then being in the healthcare space. We actually do have a dedicated group that handles like the testing and contact tracing and notification and making sure things are kept private. Now, not every FM organization has that benefit and privilege, and sometimes that onus is going to fall on the FMs themselves. So the one recommendation I could make is really to make that dedicated team and strategy and ensure that it complies with the right healthcare privacy laws and so on, so that you're able to do that type of contact tracing, but you're not doing it in a way that might release somebody's private information.
Yeah, Stan, do you have any thoughts on this? Because you have private clients of all different shapes and sizes. Are there any things you've been able to gain so far as to how to guide them in making these decisions around protocols and how to work with their teams to do it? Is that something that you've had to deal with just yet, or is it still in the planning process?
No, it's Kylash mentioned about technology, the Industrial Revolution 4 and the tech that's available to us today. If that's used in the proper way, I believe the future of FM is not going to, tech's not going to replace us, but it's going to become an integral part of what FM is all about. We can maintain environmental conditions to a finite degree, to the benefit of individuals and their well-being. Now, I'm not saying it's going to tell you you've got coronavirus, but it's going to cover a lot of that environmental aspect of utilization of space and occupancy levels, etc., etc. So looking forward, we should be looking at tech, but I think in the short term, we need to be focused on belt and braces, as I would call it, practical things that we can very, very easily do in order to encourage and communicate that coming back to work is something you should be thinking about. We are being proactive. We are preparing the workplace so that it is safe, and we're going to do that in a cautious manner. And I would like to make one comment right now about today's situation is with having so many of our customers working from home, we should not be neglecting the need for ergonomic assessment of how they're working from home. to make sure that the ergonomics of their workspace and how they are configuring it, that we give them proper support and guidance where required.
That's a great point. Something that I've heard a lot of anecdotal stories about. My back hurts and I'm just not used to this. I've even been someone who's been a remote worker for most of my career, and this has put a strain on me because I usually get those breaks where I'm traveling to a conference or getting out of the house to go over to Starbucks for a little while and breaking up the routine, but it's not something that's possible today. So weeks go by and it becomes a strain on all of us. Randy, any questions that I have not covered? There's people from all different industries. We thank you all for your contribution. I'm sorry we can't get to all of them here in the final 5 minutes, but is there one that jumped out to you, Randy, that we should address?
Yeah, thanks, Mike. Since we have Stan on the line, there's a question around standards, and the question is, are industry standards being created for FMs to safely ID and perform essential tasks to maintain closed facilities during quarantine closures, and similarly, to set ourselves up for success for reopening and beyond?
Okay, yes and no is the answer. We already have the 41,000 family of ISO standards exist, and they are generic in nature, but 41,001 is the management system standard. And for those that are listening to this, if you haven't read it and you don't know anything about it, it is the international benchmark of best practice. And as I said at the beginning, it talks about risk management, but in a reasonably generic manner. But though people have already come back to me that have applied that in their organizations and have seen real tangible benefit as this pandemic has hit them, because they've at least been semi-prepared for how to react. The second part, there is no international standard today to answer those specific requirements, but I can tell you now that in June this year, we are starting a new ISO standard for FM about the management of pandemic flus. Mm-hmm. So there will be one. Because pandemics are not new, they've happened for long time, and they will come again after coronavirus is finished. So watch this space. We are going to start working in January on a new international standard for the management of pandemics from an FM perspective.
Excellent. And if I may, just in the final minutes here, Randy, unless you have another real, and we're just running out of time, and I know that you and your team will do a great job addressing any questions that we didn't get to today. So again, thank you all for your contribution, folks. It's been incredible, the amount of dialogue in the chat and in the Q&A box. But I wanted to leave this by asking each of you. Stormy, I'll start with you as far as the human side of all this, right? Facility management is people management. We're all about the people, the occupants of our facilities, and caring for the employees and the visitors that come to see us. And now we're all going to be faced with this new challenge of getting people comfortable to leave their homes and return to some new semblance of public life, and maybe come back to workplaces and buildings and retail operations and eventually entertainments and sports complexes. You know, I'm a huge Washington Nationals fan. I guess our Nationals will be champions for a long time here in the DC area, but we want to get back to that new normal, that new frontier. So Stormy, how are you doing personally managing all this? How's your mindset, and give us some optimism for the future when it comes to just taking care of ourselves and our facilities and the people inside them?
My mindset is very positive. And I think, as I think all of us have said today, we have to look upon this as an opportunity. If ever there was a time when the facility profession could step up to the plate and show the important role that we play overall in our parent organizations and how we can help to make this new frontier easier to navigate, I think this is the opportunity for us. The road is not going to be easy, but we faced difficult decisions in the past. And so I think we have to trudge forward with optimism and an opportunity, if we need to reinvent ourselves once again.
Awesome. And Kylash, how you doing? You holding up okay personally, and any advice for our audience?
Yes, absolutely. I'm doing well as Stormy is. I'm a big believer that if we take care of our own mental health, that will allow us to do our work better. It will uplift others, and it will allow others to promote their own mental health. So my biggest suggestions are get back to the basics and stay with them for the rest of your life. Get a good night of sleep, drink water, eat fruits and vegetables, exercise, do breathing exercises or meditation. Those things work absolute wonders for me. Doesn't matter what age you are. I think those things are just great for everybody.
That's great. That's awesome advice. And somebody told me the example is, when you're on a plane and there's an emergency, you put the oxygen mask on yourself first, so then you can care for those around you and help them in this situation. So great advice to take care of ourselves and stay healthy as we get through this. We're out of time, and I want to just let you know that there are opportunities to continue this conversation, this dialogue. My podcast is kind of an evergreen content where we do interviews and recordings, but we've decided in the last 5-6 weeks to have these interactive conversations every Wednesday at noon Eastern. And I invite you to join me and guests that maybe we'll get Kylash and Stormy and Stan to be on in a future week to continue this discussion, and Randy. There's such a great community of experts and experienced professionals in our facility management and workplace communities. So if you want more information, go to www.workplaceinnovator.com. And with the well-being conversation, something that came to mind, I have a webinar I'm going to be hosting next week. You may know this gentleman. He's been well known in our facility management and workplace community for a long time, Rex Miller. He's the author of a book called The Healthy Workplace Nudge and others. And we're going to have this conversation around managing our stress, the stress of our employees, and getting back to a human workplace in the coming weeks and months. So I invite you to join us for that event as well. And Randy, if you can close us out, I just want to say thank you for having me here. It's been a privilege to be a part of this discussion, and to our panelists, Stan, Stormy, and Kylash, thank you so much for your contributions today.
Yeah, well, Mike, the pleasure's ours, really. Thank you so much. Excellent job as usual. Stan, Stormy, Kylash, thank you. We appreciate it very much, and all the great information. We have posted in the chat a link to our Pro FM Credential LinkedIn events page, where we'll continue the discussion around this topic. In addition, profmi.org is a great resource for information related to the program, to the education, to the credential, and then a specific page around the pandemic and business continuity as it relates to the pandemic. So we've got a lot of good resources out there. As I mentioned earlier in the conversation, you'll be getting an email from us if you've registered with a link to the recording of this session today. And with that, I think we will say have a great rest of your Thursday, and we look forward to seeing you all down the road.
Great. Take care. Thanks.
Thanks.
Hey, everyone.
Peace
Thank you.
out.